Hello, Nika.
Hello po. Good afternoon po.
Hi. Hindi ko nakikita yung aking video. Can you see me?
Yes po, Doc.
Yeah, hindi yung PNHRS background, ano?
Opo.
Kasi, na-download ko lang siya, tapos hindi ko na alam paano gawing background ko. Ano ba yan? Forum na ba tayo?
Yes po, Doc. But I think po, papasok na po si Sir Paul.
Hi, Mama Lu.
Hello, Eva Marie. Miss you, ah. Tagal-tagal na.
I know. Magkikita ba tayo sa doon sa Clark?
Yeah, I'm going to Clark.
Okay, so we'll see each
tomorrow.
other.
Yeah.
Ako din, tomorrow. Buti nga thank you na pumayag kayong ma-move to ng kasi kaninang umaga busy kami ni Dr. Jamie sa PhilAs naman. Sama si Secretary. So natapos naman yun ng thank you.
Basta ikaw. I had the notion nga, siguro si Eva itong toxic na to.
Kailangan ko pang bumalik sa Ilocos, ma'am, para kainin yung prepare mo sa aking bagnet. Diba, ma'am?
Hello, good afternoon po.
Hi, hello, Sir Paul.
Hi, Dr. Eva. I think we also have here si Ma'am Mayun, Dr. afternoon. Mr. Ney.
Sir, parang nagkaano kayo?
May echo si Paul.
Nag-e-echo ka, Sir Paul.
Magkatabi kami si Secretary. Ayusin lang namin.
Isa dapat mag-off ng
Hindi tayo sabay ng
Nasa Ilocos ka pa, Ma'am Malu?
Hindi, nasa Kainta, taking a break.
Okay.
I had to swing by Baguio over the weekend to check the house kasi di ba yung after the earthquake.
Right. Okay naman.
Yeah, awa ng Diyos. Everything like we just left the day before. Ganun.
Grabe rin yun, Ma'am, no? Where were you at that time?
Ilocos.
And did you feel it very
Oh, yeah.
Oh.
Sabi ko, shaken but not scared.
Ako kasi cover earthquake survivor. So takot na takot talaga ako sa mga shaking of the earth.
Anong earthquake ang naano mo?
7.2. Yung sa Kobe, Japan. Nandun ako, nag-aaral ako nandun
Oh my God.
Walang pagkain, nasira railway.
Oo, grabe. Grabe nung dyan sa amin. Kasi 7.1 in Ilocos, in Batak. Malakas din. Maraming cracks. Tsaka derail na yung yung relays ng C-arm namin doon sa CAF lab. So, kakainis. But at least the emergency evacuation worked for the lower floors. Upper floors, kasi di ba high-rise kami?
Yeah.
Nag-stay in shelter in place yung staff and patients. Ayaw na nilang gumalaw Kasi parang when you think na matatapos na siya, tuloy-tuloy pa rin siya at lumalakas pa, parang nakakapikon.
Oo. Kakatakot, diba? Ako nga for a while parang may ko dyan yung talagang sensitive ako sa earth movements sa movement ng earth after being in Kobe.
Yeah, I was dizzy for several days after. Kasi panay din ng diba? Aftershocks.
Yeah.
Ayun na naman, dizzy ka na naman. Ano ba yan?
Ay, naku. Kawawa yung mga yung mga churches na nag-crash.
Yeah. Yun ang pinakamalaking loss yung mga antique na churches.
Yeah.
Antique na buildings.
Sana ma-repair.
Ay,
Hi,
Janet,
Dr. Daisa. I think
we're okay na. Yun si Mama.
we already
Dr.
have a
Enrica.
quorum.
Yay.
Yeah. Sige.
Yeah, we're just waiting dun sa ating representative from NEDA. But I think he can just catch up na lang po so that we can manage our time. So
Retired po ba si Ma'am Ruiz?
Yeah,
retired na,
nag-retire
ma'am.
na.
Oh, nabawasan na tayo.
Yes.
The original.
So if okay with you, Dr. Taisa, we can already formally start our
Oh, yes,
RAMC
please.
meeting. Okay.
Oo.
Okay. So good afternoon, everyone. Thank you for accommodating our request for a meeting for this PNHRS week. Part po tayo ng ating pre-conference activities for this 14th PNHRS week. So first of all, I would like to acknowledge the presence of our RAMC members. So of course, we have our chair. Later, ipapakilala pa rin uli kayo because we have some reaffirmations and new members. But of course, we have here our chair, Dr. Lourdes Otaiza, our vice chair, Dr. Eva Marie Cuchonco de La Paz. We also have representatives from our core agencies. Of course, I'm Paul De Leon. I'm from DOSTPCHRD. From DOH, HPDPB, we have Renee Gasgonia. Miss Renee, good afternoon.
Good afternoon, Dr. Good afternoon, everyone.
Good afternoon. Then we also have here representatives from our regions. Si Dr. Aritha Liwag. Good afternoon, Dr. Liwag.
Hello, good afternoon. Nice
Okay.
to see everybody except that wala akong camera. So, yung picture ko na lang will be joining us.
Okay lang po, ma'am. Then we
Hi.
also, from CHED, we have Miss Mayumi Belandres. Hi, Ma'am Mayumi.
Good afternoon po.
Good afternoon. Then we also have Dr. A, Dr. Alan Ferranil. Dr. A, good afternoon. Okay, then of course we will be joined also by our secretariats. We have Miss Nika Luis de Mesa, Miss Jovel Ambrosio, and Miss Andrea Almonte, and our documenter for this session, we have Miss Abigail Solis. So good afternoon, everyone. So for today, we're going to have, actually it's going to be a short discussion depending on, of course, our queries and further queries to our partner, which is IHO, who will be presenting later the current status of the evaluation of the National Unified Health Research Agenda. But as you can see in your screen, the main program or the main flow of our program, first we're going to start as a refresher, siguro yung presentation of our mandates, accomplishments, and current accomplishments, focusing on last year. So the scope of our report will be from August 2021 up until July 2022, after a almost 2-year hiatus due to the COVID situation. It will be presented by Ms. Nika Luis. Then after that, we're going to have the presentation from Ms. Kim Sales, the board member of IHO. This is going to be the core of our discussion for this afternoon. The presentation of IHO regarding the post-assessment of the project entitled Evaluation of the National Unified Health Research Agenda 2017-2022 in preparation for the next Nura. Then after that, we're going to have open discussions and questions and answers to the prior presentations. And afterward, we're going to hear any insights for future plans and other ways forward, specifically on the development of the new Nura for 2023 to 2028, to be headed by Dr. Otaiza and of course our RAMC members. So to start our first item in the agenda, may I request Nika to present the accomplishment and other activities of RAMC.
Thank you po, Sir Paul. Good day po. I'm Nika Dimesa, one of the RAMC Secretariats, and I'm going to provide you po a report regarding the current status of our activities, focusing also on the accomplishments from August 2021 to July 2022. Next slide po. So the presentation po will focus on the RAMC members, mandates, and advocacy activities. But first, we will introduce you the members, and then we will share you the mandates. And lastly, we will provide you some accomplishments and advocacies we are doing so far. Before we start for the actual report, considering that there are some changes in the membership, we are providing you the list of our current Research Agenda Management Committee or RAMC members. So the RAMC is typically composed of representatives from core agencies of the PNHRS or the DOST-PCHRD, UPNIH, DOST, and CHED, and then Luzon, Visayas, and Mindanao regions, NEDA, private institutions, and other organizations that we seek to be included in the members. First, we have the chair and the vice chair of the RAMC. Dr. Maria Lourdes K. Otaiza, the RAMC chair and chair of the Region 1 Health Research and Development Consortium, and Dr. Eva Maria Cotionco de la Paz, the RAMC vice chair and executive director of the UP National Institutes of Health. Next slide po. We also have representatives from the PNHRS core agencies, namely, first, Mr. Paul Ernest N. De Leon, representing the Department of Science and Technology, Philippine Council for Health Research and Development, or DOST-PCHRD, and then Ms. Mayumi C. Belandres for the Commission on Higher Education, or CHED, Ms. Renee C. Gasgonia for the Department of Health, and Ms. Jasmine E. Abanilla as an alternate. And then Dr. Eva Maria Cotionco de la Paz, our Vice Chair for the UPNIH. Next slide po. And next we have the regional representatives, Dr. Arita Ann G. Liwag, representing the Visayas regions, and also Dr. Maria Lourdes K. Otaiza, our chair for the Luzon regions. And for the Mindanao regions, unfortunately po, we are still looking for its representative. Hopefully, we can have representatives on board for the next couple of months. We also have Mr. Tomasito P. Havate Jr., a new member representing the National Economic and Development Authority, or NEDA, and Ms. Camille F. Rivera as an alternate. And of course, we have Dr. Alan B. Ferranil, one of the longest members of the committee, who will be our member representing private institutions. Next slide po. Next slide, please. For the committee secretariat, we have Ms. Nika Demesa and Ms. Juvel Ambrosio, both from the Research and Development Management Division, or RDMD, of the PCHRD. Reaffirmation and courtesy visits were done to members of the RAMC. During this, current activities and plans of the RAMC were discussed, and further visits to other offices will be scheduled. RAMC Secretariat had a courtesy visit to Dr. Maria Lourdes K. Otaiza, RAMC Chair at Mariano Marcos Memorial Hospital and Medical Center, Batac City, Ilocos Norte, last June 16, 2022. Next slide po. RAMC Secretariat had a meeting with Ms. Mayumi Belandres, RAMC member, and other CHED officials at the CHED main office last July 20, 2022. Next slide po. We'll now proceed as a refresher to mandates of the RAMC based on the PCHRD Special Order number 22047 dated January 3, 2022, amendment to the PCHRD Special Order number 21142 series of 2021, otherwise known as the creation of the Philippine National Health Research System Technical Working Committees, Functions, and Guidelines. Next slide po. So the PNHRS Research Agenda Management Committee, or RAMC, is one of the technical working committees of the Philippine National Health Research System or PNHRS that provides policy and technical advice in planning, formulating, monitoring, and updating of the National Unified Health Research Agenda or NURA. Track and evaluate the use and adoption of the NURA as reference in health research projects and programs, and implement programs and activities in support and advocacy to the research priorities set in the NURA. Next slide po. Basically, the report po on accomplishments is based on our current mandates. Next slide po. So as early as last year, we have been conducting a number of activities with the IHO with regard to the post-assessment of NURA 2017-2022 in preparation of the development of the next agenda. The specifics of the report regarding the accomplishments will be provided and will be discussed later by the IHO. This will only be an overview or gist of the activity. So given that the current NURA is about to end its term, the IHO, led by Dr. Miguel Dorotan, was commissioned to implement the project entitled Evaluation of the National Unified Health Agenda 2017 to 2022. So it aims to conduct an outcome evaluation of the short-term outputs of the NURA 2017-2022. The data generated from this project can be used in decision-making, implementation, improvement, and subsequent research agenda formulation. It is composed of two phases. Phase 1 for the development of the evaluation plan, and Phase 2 for the actual evaluation. In Phase 1, literature and document review and Delphi consultations were done to understand the policy or program and its implementation context. Then subsequently, focused on the evaluation, design, or framework or plan. And then Phase 2 will be determined by the results of Phase 1. Specific quantitative findings are identified for additional inquiry using qualitative methods of data collection and analysis. Quantitative data were gathered through online surveys, while qualitative data were collected through KIIs and FGDs. So to date po, the IHO has already completed the Phase 2 of the project. They've conducted key informant interviews with different stakeholders for the qualitative data. They've also gathered the number of research proposals or projects from all 17 regions and other public and private institutions, which will be used for the quantitative report of the project. Next, the health research alignment was monitored through submitted proposals and funded projects of the PNHRS core agencies. So the following are the number of proposals and projects that are found to be aligned with the NURA 2017 to 2022. So in DOST-PCHRD, we have 535 proposals from 2020 to 2022. In UPNIH, you have 44 projects from 2017 to 2022. And in DOH, you have 79 projects from 2018 to 2022. And then from CHED, we have 49 projects from 2017 to 2021. Please note po that monitoring and validation of numbers are currently ongoing. Regional R&Ds will also be included. Next slide po. As part of the advocacy of the RAMC to disseminate and promote alignment of health research to NURA 2017-2022, different activities such as speakerships, attending workshops, and consultative meetings with regard to agenda setting were undertaken. Right after easing lockdowns and restriction measures on COVID-19 pandemic, the RAMC resumed its activities. So Secretariat have attended to workshop on the formulation of the National Volunteerism Research Agenda. So the workshop was conducted by the Philippine National Volunteerism Service Coordinating Agency of the NEDA and was held at the F1 Hotel BGC Taguig City last May 18 to 20, 2022. Its objective was to gather useful data for the drafting and development of the National Volunteerism Research Agenda. And during this, Mr. Paul De Leon, RAMC Core Agency Representative, presented and introduced the Nura 2017 to 2022 and its research priorities. He encouraged the integration of the planned NVRA to the Nura 2017-2022 and attendees to craft or submit proposals that are aligned to the health research agenda. Next slide po. Consultative meeting regarding agenda setting. This consultative meeting is a follow-up meeting regarding the crafting of dermatology research agenda. So the RAMC, Mr. De Leon and Ms. De Mesa were invited by the Rizal Medical Skin Center last May 27, 2022 for a consultative meeting to check the current status of their agenda and ensure that it is gearing towards the health research agenda or supplemental to the National Unified Health Research Agenda. Next slide po. PCHRD consultative discussions and partnership-based visit. Ms. De Mesa, RAMC Secretariat, presented and introduced the Nura 2017-2022 and HNRDA 2017-2022 during the consultative meeting at the University of Northern Philippines, Vigan, Ilocos Sur last June 18, 2022. Next slide po. Telehealth Secrets Manila Workshop. Mr. Paul De Leon was invited as a resource speaker to a workshop on telemedicine last August 2, 2022. As part of his presentation entitled Health Research During the Pandemic, Challenges, Priorities, and Opportunities, the Nura 2017-2022 and its priorities were highlighted. He highlighted possible collaborations and encouraged participants to be part of the discussion and drafting of the next Nura. This will ensure the alignment of health research from non-member institutions with the Nura. Next slide po. As part of the next advocacy activities, next slide please. The RAMC planned to have the following activities for the dissemination and promotion of the Nura. So the RAMC will be attending a number of agenda setting meetings. For example, the upcoming First National Defense College of the Philippines on August 16, 2022 at Luxent Hotel, Quezon City. And then the RAMC will discuss the preparation for the development and drafting of the next Nura for 2023 to 2028. Next slide po. The RAMC will conduct regional visits in preparation for the development of the next National Unified Health Research or Nura 2023 to 2028, and also as part of the monitoring and evaluation. Last, the RAMC will also provide assistance to different agencies or institutions, either public and private, with regard to their research agenda setting. This is to ensure that the research agenda to be developed can be integrated and aligned with the National Unified Health Research Agenda. Before we end the presentation po, please note that most of the report that we have regarding the activities and accomplishments of the RAMC were basically from the schedule and calendar of the PCHRD. And we would like po to request each of everyone to provide us your activities related to the Nura that your agencies had done for the last 1 year so we can include it to the final report. So that's all po. Thank you.
Okay, thank you, Nika, for your presentation. Any comments from our RAMC members? Again, please take note that the activities that we have presented are basically based on the calendars and other activities and other invites for PCHRD. But I know that there are also a lot of activities from our core agencies, from the regions, and from our other partners. So we would be gathering all of those activities as well and include them in the accomplishments of RAMC for this period. Actually, we're trying to gather all of the activities of RAMC for the last 6 years. So we hope we can get your reports as soon as possible. So any questions? Yes, Doc Eva. Yes, ma'am.
Yes, Sir Paul. first question ko, ba't di nyo kami sinama nang pumunta kayo sa mga kila Dr. Otaiza? Joke lang.
Hindi. Ma'am, of course, sasama namin kayo. Kaya nga sabi ko, dun sa script, baka makita na dalawa pa lang yung pinupuntahan namin. Of course, ma'am, tayo pa magkalapit.
Siyempre, gusto kong pumunta kay Dr. Otaiza. But now, seriously, my question is, slide number 13. If you may, Miss Nika, slide number 13. Kasi, I know you mentioned that you're still vetting these numbers, but medyo parang ang concern ko lang, for example, if you, at saka kanina, Miss Nika, parang iba yung sinasabi mo rito sa nakasulat. Iba yung mini-mention mo, yung CHED and DOH. I don't know kung nagkapalit dun sa iyong notes. At saka,
parang I think nagkabaliktad nga kasi parang 49 pero 44 yung nakalagay. So we'll double check that.
Right. Now the other, but my greater question that of course is something na pwede naman ma-correct is, kasi like for example, if meron kaming database, so madali ko na pull out to in 24 hours na hiningi ni Miss Nika yan na 44, tapos nag-group na namin sila sa yung ating priority, sa Nura themes, no? My question is, kasi syempre yung aming 44 na yan, na-fund yan ng DOST-PCHRD. Hindi kaya nakakount tong 44 na to dito sa 535? That's my concern.
Yeah. Actually, ma'am, that's part of our validation kasi I have the same concern. I know there are a number of activities and initiatives then, pati internal funding ang NIH, di ba ma'am, din sa mga either faculty nyo or mga students then. I think you have some those initiatives. So that's going to be part of our validation kasi aside from the numbers, we want to include there or input there the type of initiative kung saan namin nakuha itong mga numbers na to. For example, ma'am, for DOST-PCHRD, I know most of that will came from the call for proposals, but at the same time, meron pa rin tayo mga mga international collaborations like yung natin, di ba, yung PCHRD Massachusetts General Hospital. So hindi naman siya nakapasok dun sa CFP, but we'll try to include that. The same with CHED, nakausap namin si Ma'am Mayumi. They have some initiatives then. Tapos meron sila mga focus areas related to health. Then for the DOH, I think most dito is yung sa AHED. But aside from that kasi, meron pa rin pumapasok sa amin na parang hiwalay na partnership. Example, the pharmaceutical division of DOH, they also downloaded the money to PCHRT, but that is outside AHED. So, tapos ma'am, yun nga, sabi ko rin, wala pa dito yung, yung sa regions, sa mga regional research fund natin. Medyo madami yon kasi that's going to be the next kumbaga part of our activity in terms of validation. We'll really try to capture kung ilan yung mga numbers, yung basically yung sa RURA nila, di ba? Region 1 to region up until BARM, we'll try to get the numbers and of course validate para hindi po tayo magkaroon ng duplication. So right now, this is just parang overview lang kasi kung narinig niyo man sa report din ni Nika, iba-iba kunwari yung sa PCHRD 2021, 2020, 2022, then May 2018 to 2020. So we'll try to be consistent. Medyo mahirap lang ma'am yung makuha yung mga numbers as of this time. But hopefully before we really end yung etong Nura 2022 for this year, we can capture all those numbers and conduct validation then para at least alam po natin yung naging distribution.
Thank you, Sir Paul.
So I hope yun po, sabi nga namin, we're going to conduct mga validation institution visits pa rin to the core agencies and to the regions also to validate those numbers. Kung hindi po siya magiging part ng mga activities din ng IHO, it's going to be part of the activities of the PCHRD as the lead secretariat. Any questions?
Sir Paul, if I may chime in from DOH, HPDPB. Hello, sir.
Yes, Renee, yes. Go
Yes.
ahead.
Yeah, I would just also like to resonate the comment a while back. So essentially, we have 79 studies that are aligned with the Nura. But again, there may be duplicates as to the proponents coming from UP Manila. Oo. So, yun nga po. You're right on that you're gonna do a validation of what essential studies are already duplicates and just check on the numbers. And so we simply call it out from the research projects from the year 2017 to the 2022. But maybe if you have another set of criteria where you'd like to evaluate what specific category or section of the Nura you'd like to look into, if there are more researches on this area, maybe that could already be an additional criteria to look into as to what specific areas still need to be reinforced with more studies, or what areas are lagging behind. Thank you.
Yes. Yeah, thank you, Miss Renee. Actually, I don't know, we'll try to, especially for DOH, I know there are a number of initiatives then and programs not only under AHEAD. So we'll try to gather as much information regarding your health research then, yung mga R&Ds ninyo. Then with your other suggestion to look into what probably what thematic or themes dun sa Nura yung na-fundan natin. Let's see if that is part of the report of IHO. If not, then maybe we can supplement that with additional activities. Thank you. May nag-feedback lang po. Kindly mute na lang po from your end.
Yes, Sir Atan yata.
Okay,
Sir
Doc A.
Atan.
Doc A, nakaano po yung ano niya? Yung mic.
Akin ba?
Yes, Doc A.
May comment lang ako, Paul.
Sige, Doc A. Sige po.
It's best to show instead of numbers, yung proportions actually ang mas maganda. At saka sa time frame, pare-pareho. Yung 535 of how many yan dapat. Kasi we would know kung marami o konti. Kasi kung numbers lang misleading. Kasi pwedeng UPNH 44 o 44. Diba? So, ano ko lang, proportions mas maganda pag-report rather than numbers.
Okay, Doc A, noted. Kasi I think that's I think that's very possible naman considering that ito kasi mga approved natin, so meron tayo mga disapproved, so we would know from the disapproved kung ilan yung na-disapprove doon due to non-alignment to the Nura. Sige po. Doc A, may sabihin pa po kayo? Okay. Sige, any other comments or suggestions so that we can integrate it? Yes, Doc A.
Okay na, Paul.
Okay na. Okay, thank you, Doc A. Okay. So, we'll get in touch with each one of you, especially yung sa consortium po natin, so that we can include the numbers also dun sa ating mga R&Ds from the region. Okay? If there are no further comments, I think some of your comments will also be tackled or presented by IHO later regarding dun sa alignment, and if there are other areas doon that needs to be kumbaga assisted more or invested more. Okay.
Question lang, Paul, if I may. If we're advocating also to the private sector, so what do we measure? Whose stats do we measure?
Actually, Doc Otaysa, that is one of the the assignments that we ask IHO to include in their report, kasi even from the previous meetings natin, that is one area now we're really having some problems. Yung private industry, kasi from the previous report, di ba po parang 3% lang yung participation kasi ng ating private sector. So we want to increase the participation of private sector for this Nura. So hopefully masagot po yan ng ating IHO later. But from our end sa sa lead secretariat, we are also trying to kumbaga brainstorm on how we can check on those data kasi una po kung private sector siya, of course there's pharmaceutical companies, there are biotech companies, then meron na rin po tayong mga, actually hindi lang po private but other agencies, kahit mga CSOs, mga foundations, will try to ipasok po silang lahat for this most probably for the next Nura, but the numbers will try to get it also for this agenda, ma'am. Pero so far I hope that is something na we can discuss din po with RAMC dun sa mga next steps natin on how we can really incorporate the participation of the private sector in the Nura.
Kasi like if a private university, baka the statistics would be counted under CHED, ganun ba yun? So we'd like to be clarified if that's the case, di ba? Otherwise we'll be doubling our stats. And perhaps if we really targeted for example, specialty societies which are private, then we can track who picks up the Nura from them, diba? If we really had a structured communication plan, then we can follow up from them, diba? Okay, thank you.
Yes, ma'am. I think that's a good suggestion kasi right now I think yung mga naging activities and yung mga na-report natin po from the previous years are basically yun nga, mga conferences, symposiums, events na tayo yung ini-invite, but it would be good if we're going to have that initiative na naka-line up na po dun sa ating communication plan para at least kumbaga makaka-sure tayo na talagang maka-capture natin all of the organizations, both public and private, na we are really targeting na ma-orient or ma-present po sa kanila yung Nura. So we'll note of that, we'll take note of that, Dr. Liza. Okay, any other comments? Okay. Before we proceed, let me just acknowledge the presence of our representative from NEDA, Mr. Tomasito Habate. Hi, sir. Good afternoon po.
Hello, good afternoon. Actually, kanina pa ako before 1 I wasn't hindi ako na-admit, so I'm not sure kung akala ko hindi pa nag-start. I was contacting the secretary anyways.
Our apologies, sir. But we just started lang naman po. We presented the current accomplishment, but we're proceeding now with the core topic of our discussion, which is basically the assessment of our current National Unified Health Research Agenda. So far po ba, sir, may may questions kayo regarding the accomplishment report?
Actually, kaka-enter ko lang.
Kaka-admit
lang sa akin. Siguro, review na lang the document.
We'll share with you and the other members the document. Okay. So for us to proceed, maybe we can admit already the IHO for them to present the current status of the post-assessment of Nura 2017 to 2022. Okay, so I'm seeing here we have Dr. Migs Dorotan. Good afternoon, Doc Migs. We also have Miss Kim Sales, Catherine Burgonyo, and Mary Catherine Santiago, and I think nakita ko rin si Dr. Joseph Orano, and Miss Crizel Fowler. Ano pala sila, madami ang IHO ngayon. So full blast ang nila, ang presentation.
Force.
Kompleto, full force kayo, no?
Kala namin face-to-face, Sir Paul, eh.
Oo. Baka next year, tingnan natin. Doc Migs, siguro doon nasabi ko na yung mga pangalan nung mga na-admit, maybe you can formally introduce your team and you may proceed with the presentation. Thank you.
Maraming salamat, Sir Paul. Ma'am Eva, Takotaiza, Sir Alan, sino pa dito? Then the rest of the RAMC. Magandang hapon po sa lahat. In behalf of IHO, we thank you for this opportunity to present our preliminary results. Together with me in the IHO team, we have Kim Sales, former deputy director, but currently are part of the board already, and will be the one presenting the results ngayong hapon po. And then the rest of the team, Joseph Oranio, Kat, Dane, Grizel, and then kasama ba natin si M? Kim hindi, di ba? Atin ba?
Hindi ata dahil sa time difference.
Not us, but si M na writer hindi yan sa atin, no? Atin ba? No.
Hindi.
Not tayo. So yun. So I'll give the floor to Kim. May we present? Thank you.
Yeah, sorry. Kailangan ko lang magpalit ng earphone. Sorry. Wait lang. Mga 2 minutes.
Alright. Sige. Thank you. At habang nag-aantay si technical glitch lang. Sir Paul and the rest of the RAMC po, I'd like to take over this opportunity as well. Siguro lang to mention that the Alliance for Improving Health Outcomes have made its transition under its leadership. So I'm no longer the executive director as of August 1. Kim also have transitioned out as a deputy director. So we now have the new executive director, Dr. Villa Roderos. And I think we sent an email introducing them as well. But we're still part of the organization. I'm still a partner of the organization. Kim has been elected to the board of trustees of the organization. So we'll still be around for IHO. Okay, Kim, when you're ready.
Okay, thanks Ming sa introduction. Hi, good afternoon to everyone. So we'll be presenting some preliminary results from our evaluation. Can you enable participant screen sharing? Okay, all right. So just a reminder for everyone on the background and objectives of the project. So research agendas, or specifically national research agendas in global literature, actually are not usually evaluated. So it's a very good practice of Philippines. Now we've always managed to have an end-term evaluation of our Nuras. We usually do this again kasi an evaluation of a program or policy allows us to revise the design or decide to implement or end the implementation or a program or policy. Again, just a reminder that this is like one of the main frameworks we referenced when we designed the evaluation. So I think yung in-emphasize lang dito is that for this evaluation, we can only be expected to evaluate up to the expected outputs kasi yung results and impact can only be attributable or measured sa program from up to 5 years after, and then for impacts 5 years and beyond. So realistically, parang ano lang ba yung data na meron tayo on hand when we began this evaluation. So we are only conducting a evaluation of the short-term outputs of Nura 2017 to 2022. So just quickly, what was the evaluation methodology? So we had 2 phases. We developed the evaluation plan through a systematic literature review of research agenda evaluation, where we screened almost 1,800 documents and only 6 were included or passed the screening. And then Joseph also conducted a organizational analysis of Nura implementation. One consultation was held with RAMC to finalize the evaluation plan. That was January 26. And then around the first week of February, the final evaluation plan was approved. For the evaluation, we did a mixed method evaluation. So we conducted 46 interviews across 9 different regions plus national offices, as well as collected secondary reports from 12 regions for quantitative data collection and analysis. So just quickly, balikan lang natin yung evaluation questions. So for advocacy, it's about the research direction and prioritization impact of Nura throughout the country. For relevance, it's about how did the Nura 3 continue to be relevant through 6 years of implementation, particularly since noong 2017, we developed it in a very different pre-COVID context. As compared to the years through which it was implemented. For effectiveness, it's looking at parang the Nura outputs and outcomes, initial outcomes, and research funding efficiency and allocation. For impact, yun yung mga preliminary intended and unintended differences which the Nura has made to the lives and health of the Filipino people, as well as the significance and utilization of research outputs. So again, just emphasizing that we're still in the process of fully analyzing the results. So more details will be provided in the final report. For advocacy, the key question was how did the Nura influence research direction and priorities in the country? So generally, it is the consortium members that advocate for the Nura through different platforms or activities, from more traditional brochures and flyers and meetings to using email blasts and website announcements or social media. So based on our interviews, there are 3 main reasons why advocacy activities are done. Number 1, in the hopes that it will develop more proposals that are aligned with the priorities. Second, provide more information on the list of priorities and to entice institutions to use the Nura as a reference when they do their own research prioritization or when they fund research. So marami namang target audiences, but I think mostly these are limited to consortium members. So and researchers. So new project leads, although interestingly, it's also communicated to local chief executives and LGUs up to barangay health workers. Most of the activities are workshops or conferences, but other types of activities such as online posts, campaigns were also reported. So sa others, this includes consultations, surveys, or email communications. Sa reporting, sinasabi nila na parang isang beses lang daw nag-advocate. But when we reviewed the raw initiatives, actually madami namang events over the years. I think yung significant lang for this or something to take note of is for 2022, we were only able to include activities done for the first half of the year. In terms of the timing, most of the activities talaga are from April to December. So parang may short break at the start of the year, maybe to plan for activities. In terms of dissemination level, most of the advocacies are done at the regional level. National level dissemination, medyo rare siya at 7. Parang throughout 6 years, parang based on the reports, parang 7 lang yung activities na nagawa for Nura at the national level. Which is kind of in line with what we found. Yung efforts naman of advocacy is medyo in line with the findings in the interview. So 25% of informants said na hindi sila aware sa Nura or naging aware lang sila sa Nura nung in-invite namin silang mag-participate sa study. However, most naman, almost 75% were aware either as part of their work or na-involve kasi sila when it was developed in 2017. However, out of the 35 that said they were aware, parang may 6 na sinabi na medyo hindi super in-depth yung knowledge nila about the Nura. In terms of adoption, 23.4% reported having their own institutional research agenda na hindi nagre-refer sa Nura at all. So they did not use it as a guiding document when they prioritized their own research topics. Pero almost 77% naman said na may adoption ng Nura, or at least they used it as a reference when they developed their own research agenda. And this is in line with reports from the regional consortium. So Nura adoption was found to be around at around 86%. And paano nila dino-document yung Nura adoption? So mostly these are through resolutions or memorandums or MOOs. May 15 institutions na walang data. They also consider adoption of the Nura as adoption of the Nura, since I think that's a natural alignment, since the process of the Nura 3 development was a bottom-up approach. Why exactly do they, or what were their thoughts about adoption of the Nura in summary? So they adopt the Nura kasi siya na yung compendium of the health needs of the country through the lens of multiple agencies, since it applied a multi-stakeholder approach to development in 2017. However, they also found na since sobrang daming priorities listed under Nura 3, parang they needed to identify specific institutional priorities. The Nura 3 was viewed as not just health specific, but also includes other social determinants of health na research topics. For some naman, parang they appreciate it that it's there, the Nura 3 is there, but they really view alignment as a minimum requirement to qualify for funding, instead of like appreciating that the Nura is here to parang align the health research efforts of the nation so we can solve our most urgent health problems. So parang sa kanila, nag-align lang sila, pero it's not necessarily what drives them in terms of selecting the research topic, kasi it's broad enough na gagamitin lang nila really to receive funding. Parang they qualify. It's in the Nura, so they qualify for funding. So in summary, I can highlight some best practices, challenges, and recommendations. So I think yung hindi pa na-mention sa best practices is the use of short AVPs in terms of advocating for the Nura. However, interestingly, a lot of our informants still appreciate yung more traditional forms of advocating or dissemination, such as flyers, and they really like the booklet that detailed how the Nura was developed. In terms of challenges, I think an important one is that may mga nag-mention na for research institutions that are not explicitly or specifically dedicated to health research, they do not adopt the Nura as a research agenda. So medyo nakakasayang daw, kasi I'm talking about institutions na, for example, are more focused on expertise in economics. Parang they really parang may sarili silang research priorities that don't take into account yung Nura. Mas mahirap din silang itap to take on health research grants kasi hindi naman aligned with their priorities. Pero sayang kasi we do health economics na piece as an example, pero parang kulang pa sa advocating and onboarding them with the Nura. What else? Okay, so I think another thing we can focus on sa challenge is yung focal persons in each institutions change frequently. So parang in our consortium members, yung staff turnover in terms of who is the new person assigned as the Nura coordinator, medyo mataas daw. So parang kailangan i-reorient lagi tungkol sa Nura. So medyo nakaka-interrupt siya in terms of continuity of implementing the Nura in their institution. Lastly, parang what participants want to do more is to advocate the Nura to end users of research or policymakers or community health workers. And for PCHRD to provide guidance on how they can develop their own research agenda based on the Nura, because of the broad list of topics. For relevance, this is about how the Nura 3 continued to be relevant between 2017 to 2022. So most of the informants were either directly involved or aware that there was a representative from their institution na nag-participate in Nura development noong 2017. So definitely naalala nila yung bottom-up approach, which is the development of the Rura to feed into Nura development. For them, this resolved the perception from Nura 2 or 2011 to 2016 na masyadong too central or too national. And they also think na the fact na nag-regional consultations muna to develop the Rura, they attribute this to increasing the relevance and representativeness of regional level issues in the Nura. So they were more likely to adopt the Nura kasi naalala nila na na-consult sila. So they feel some sense of ownership of the research agenda because of the bottom-up approach. We also asked them ano yung significant health events or concerns between 2017 to 2022. And of course, I think we all agree, I think COVID-19, the top 5 answers were COVID-19, the devolution or increasing devolution through Mandana's ruling, universal healthcare law, disasters and climate change, and mental health. We then asked them how did you feel these major health events affected health research? And these were more specific to COVID and Mandana's ruling. So for them, during COVID-19 or when COVID-19 happened, the research resources were all redirected to COVID. So if hindi ka COVID researcher or wala kang alignment at all to COVID, parang deferred and displaced ka. You receive no funding and deprioritized ka. When it comes to increasing devolution, parang a change in how we govern health means increasing research for strengthening local health systems. So we asked them how did the Nura 2017 to 2022 accommodate these health events. So as far as the informants know, parang walang official revisions to Nura 3. They highlighted that the Nura 3 was correct and relevant to highlight responsive health systems way back in 2017, especially after COVID happened. Institutions which informants represent updated their research agenda to reflect the changing context for health in the country. However, these changes did not necessarily need to be communicated with PCHRD or PNHRS. So it could be because sobrang broad kasi nung Nura 3 na there was no need to actually update it. Pero at least at the institutional level, parang nag-update talaga sila ng research agenda depending on the changing health context din ng country. So again, the best practice is the bottom-up consultations as well as the wide range of priorities. Pero meron ding ibang participants who said na maybe the wide range of priorities is not so, it's not so good kasi well, it's inclusive. We display inclusivity, but then parang the research agenda lacks focus. This renders some priorities maybe becoming understudied. Another highlights development process na relevant to relevance is that non-consortium members continue to be underrepresented during the development and implementation. Another challenge for our informants was that there were no feedback mechanisms during the implementation, particularly outside of consortium meetings. So they feel that research stakeholders providing feedback can possibly improve relevance. Siguro by letting the committees know ito na yung mga nagawang research, so maybe we can slowly redirect funds to other research areas sa Nura. Some recommendations for the next Nura development to improve relevance is to account for the perspective of resilience. So yung Nura mismo or development of the research agenda has to be resilient, especially after yung na-experience nung COVID na may mga research areas talaga na na-deprioritize and na-defund completely. So one possible solution for this is to pre-identify topics which have the possibility to be displaced in a scenario similar to COVID where research resources have to be redirected somewhere else. And then they also want to conduct population consultations so they actually know the health priorities of the general population. And then the conduct of a midterm evaluation and revision of the Nura to ensure that it maintains relevance to the changing health context. Moving on to effectiveness, ito yung section that's kind of long kasi may tatlong subtopics which are collaborations, monitoring, and funding, allocation, and efficiency. So we need to discuss first yung parang what data we got. So we had responses from 12 regions, tapos we were able to analyze 307 proposals. So most of these were reported from Region 11, followed by Region 6 and Region 1. Only 1 in every 4 were reported to be approved. In terms of plans for publication, majority did not report plans for publication and collaborations. So dun sa mga may data for peer review publication, only about 20% were reported to have this. For 30 proposals with collaborators, parang 20% lang talaga yung may collaborator na ni-report. What did we find out from the interviews about collaborations? So nangyayari naman siya in both public and private institutions. Usually dahil may gap in a specific technical expertise. So if one institution wants to do a project related to, for example, CPG development, pero parang wala pa siyang experience doon, naghahanap naman sila ng partnerships with another institution that has that experience. Some other expertise that were parang mentioned lacking, so they seek collaborations was for data science, research communications, and research related to tobacco and reproductive health. Co-funding collaborations are also possible with international partners, but only if their agendas all align with the Nura. So for our participants, while collaborations cannot be fully attributed to Nura, they do recognize that it encourages collaboration kasi super daming research priorities. So if you want to do a very niche research priority, mapipilitan ka talagang maghanap ng ka-collaborate. However, I think one of the main findings we had kung bakit medyo mababa pa din talaga yung collaboration is that these are still facilitated by the research institutions themselves. For them, seeking collaborations is an attractive idea, but it's very difficult and it involves more time and resources. For the topics of the proposals, global competitiveness and innovation in health theme had the highest approval rate for all the topics, followed by research to enhance and extend healthy lives. So happy to note na pag non-Nura aligned ka, hindi ka ma-approve usually sa proposal screening. The subtopics of different approval rates, if yung subtopic mo sa Nura, medyo konti lang yung nagsasubmit, I think the higher chances of your proposal being approved, that's 50 to 100% approval rate for subtopics with very few proposal submissions. But if we were to exclude these outliers, the highest approval rate was for nutrition at 46.15%. Subtopics for the approved proposals were mostly for drug discovery and development at 22.2%. Which is a huge gap from yung second and third place na 9.5% each, which is for emerging and emerging diseases. Majority of the subtopics have less than 2% of the share of the pool for approved proposals. In terms of monitoring, we asked them ano yung data points that are collected to monitor research. So overall, how we monitor research is very much focused on, it holds the view of project or grant management, as opposed to looking at outputs, outcomes, and impact. Although one informant did report na may outcome monitoring data sila, which is to look at the approval of policies by the Secretary of Health. What do they think? How do they think monitoring data is used? 3 main answers. Number 1, to monitor progress towards KPIs or key performance indicators. Number 2, to guide researchers on how their project is progressing and how their funds are being managed. And for researchers and consortium members, though, parang majority were not sure. Parang for them, they're just reporting data and submitting data. But it's not actually clear to them what happens after or what is the purpose of monitoring research. Some best practices reported sa monitoring is having a major database for research that is regularly updated. Pre-pandemic, they actually appreciate the on-site monitoring of projects. Pero okay din na it was flexible enough post-pandemic to monitor projects via email or text. Of course, na-highlight naman na the best practice pa rin ang evaluation of Nura at term end. However, the research monitoring is still generally viewed as weak. Parang there are no report. They reported receiving no reports on Nura progress or implementation. Wala ring central database to monitor different projects. There's no way to monitor research impact at the moment. The fast turnover of consortium secretariats interrupts the continuity of the tasks, particularly yung progress report. And sa committee members, I think some of them did say na parang there's an expectation that they can analyze such a large volume of data. So one of the recommendations is to increase the support staff in the PNHRS committees. At the regional level, they want to do workshops specifically aimed at getting the consortium members together to complete the monitoring reports. Another recommendation is to do the midterm or annual assessment and report to government agencies para alam nila ano yung health research needs nila na hindi pa na-address. So they would really appreciate a midterm report or a midterm assessment. For funding, based on the secondary data that we got from the regions, the total amount that was funded was around 35.5 million. The mean, every project was around 859,000 with a median of 660 and 752. Parang the minimum amount granted was around 250,000 and the maximum was 9.3 million. We asked them, where do you get your research funding? So there's a dedicated line item within the GAA, grants in aid. They're also some of them are mandated to dedicate 2% of their MOOE to research. And private and international organizations are also a source of research funding for the country. We asked them, how adequate are these research funds? Some of them did think the current funding allocation is adequate, but for most, current research funds are inadequate because meron pa ring limitations in the research that they can do with the allocated budget they have for research. For example, at the moment, if they have a list of 10 priority research areas, parang 3 lang dun yung magagawa nila in 1 year, and they need to seek external funding or external support to implement all of their priority research in 1 calendar year. The low funding allocation also affects the type of research that we can do. So multi-site or multi-year is just not possible with current allocations. What is usually done is we phase the studies year per year. Kaso yung disadvantage nun is if they need the evidence today, I mean not today, but this year, if they phase the studies until next year or 2 years from now, medyo hindi na nila kailangan yung data na yun. So what usually happens is they commission the research locally and wait for it to happen while consulting na din with global evidence or literature. So what they need the evidence for can move on. Most informants don't think that the Nura has an effect on funding allocation. That is a decrease or increase in research funding. Parang simply cannot be attributed to Nura in their opinion. When it comes to efficiency, though, the Nura was recognized by informants as one attempt at efficiency kasi sinasabi na nga ano yung priority na pupondahan natin na research. Pero parang hanggang dun na lang yung influence niya at funding efficiency. Primarily, this is because informants see funding efficiency as part of overall research efficiency. So it's not just about how fast our research funding are deposited or how the funds are used, but timeliness of research is also seen as one measure of funding efficiency. Some best practices is to continue mandating offices to allot funds for research, and that there's a standard operating procedure for screening what should be funded. Challenges are on utilization of funds because they're limited by the procurement law, or funding rules are tied to core requirements, limiting what can be done to reduce the inefficiency right now. Mayroon ding limited availability of health research, human resources to actually do the research that they want at the moment. Another challenge is there's no guide on how to cost research. Yung mga calls for proposals are based on previous TORs that na parang wala nang accounting for inflation. So a major recommendation is to develop a guidance book or reference on how much research investment the health sector needs to fulfill the Nura priorities. So parang this is viewed as by the informants as the next step. So it's good that we have the Nura, but the information to make it to actually implement the Nura, maybe the information that we all need is how much research investment is needed para ma-resolve na natin yung research priorities natin. There was also a suggestion to earmark funds for each priority area to educate policymakers so they can appreciate the use of evidence in decision making, which will hopefully lead to more investment in research. As applicable, explore the idea of preloading funds to contracted institutions. And finally, for impact, we looked at the proposals. So about 1 in every 3 did not report yung expected impact of their proposed research area. But for those that did report, 95.3% was about scientific impact, 74.4% for economic, and 66.7% for societal impact. We asked our informants ano yung expected impacts of the research that you have seen that are Nura aligned. And generally, it's about improvement of health services, attaining better health outcomes, drug and product development, improved understanding of disease epidemiology, disease control, and having some impact on policy development. We asked them about research dissemination. So they really appreciate that they are able to showcase their research sa annual DOST conference. They also consider presentation to policymakers as a form of research dissemination. Of course, there's also yung traditional academic conferences and journal publication. Some best practices, challenges, and research dissemination. So for best practices, this includes the inclusion of a manuscript and publication fee as part of the project budget. Kasi for others, after nung project, nakakalimutan na yung publication. Pero in this way, if you include it as a deliverable, medyo incentivizing siya for the research team if it's included as a deliverable. For challenges, there have been some reports that researchers publish their work before submitting a terminal report. Na kinagugulat ng end user and ng project manager nila from PNHRS or PCHRT. There's also hesitancy from end users to publish results publicly due to fear of negative reactions. There were also reports na wala naman daw nangyayari to outputs after submission, which is a challenge. And some informants reported limited support for conference presentations or publications. Some recommendations include making local conferences more affordable and thus more accessible, incentivizing researchers to publish their work, and the use of more visually appealing media to disseminate research outputs. For evidence-based decision-making, majority of the proposals did not have plans to translate their research into policy. So parang 1 in every 3 lang ang may report on this outcome. Generally, though, research and evidence is seen as an invaluable tool for decision making. So they build an evidence base using multiple sources. So number 1, local research, external consultations, global evidence and guidance, and other credible, publicly available materials. Some best practices have been the creation of websites where all research outputs are pooled, holding policy brief writing workshops for researchers and proponents, and the concept of participatory action research encouraged by the DOH. However, a significant challenge is that researchers have a small space at the table when it comes to policy decision making, or at least being present for those meetings. There's a perceived lower quality of local outputs compared to foreign published work. In general, kasi they think the accessible outputs from HERDIN, for example, are ongoing or completed studies that are not peer-reviewed. So for our end users, they would rather rely on global guidance or published work kaysa sa outputs na parang hindi sila sure na na-peer review ba. Researchers are also viewed as being in it only for academic fulfillment. So after nung project, medyo wala na silang pake. So parang they don't appreciate the role that they can play when it comes to improving decision making. For them, they're in it for the intellectual pursuit. Parang may ganung view some of our informants. But they would appreciate better engagement from researchers after the project has ended. Another challenge is may mga funded research that is actually not useful for the health program. So in that way, maybe that's considered being inefficient. Kasi why this is data that I don't need, but this research has been funded. So may mga ganun din nangyayari or na-encounter yung mga colleagues natin from the health department. It's also very difficult to monitor use of evidence in policy making. I think this is more about quality than the actual monitoring system. For example, if a policy cites a research, do we consider that as evidence-based decision making? So for them, it's more nuanced than referencing a bunch of articles. Kasi we need to go into assessing the quality of the evidence that was used to make decisions. So as a recommendation, they want to create a more enabling environment for evidence translation, starting from a more efficient research environment. They also actually really appreciate yung research blasts, which somehow has ended. Parang nag-start daw last year, but nawala na ngayon. Though I am aware that the written newsletter is ongoing because I received those emails. They also recommend involving researchers more in decision-making discussions. Be more open with sharing research outputs, particularly easing the process of participating in HERDIN. Train research on how to package and pitch their work in a less technical way, and to create more demand on using evidence for policy. So that's the end of the evaluation. So we're going to move on to presenting our limitations and implications for the next Nura development and implementation. So limitations for the quantitative data. Some regions did not submit their data despite our multiple follow-ups. So the results in our study may not be generalizable to the whole nation due to selection bias. We also only relied on documentation of the regions involved. We cannot assess the completeness of the proposal submitted. We observed different levels of completeness across regions. A recommendation to address those limitations is to get data from a more centralized source to avoid biases, such as from PCHRD directly or DOST. Another limitation is that all results were descriptive. We cannot assess why the Nura proposals were approved. Similarly, there's very limited data on the outputs and outcomes of the projects, which was also a finding of our evaluation. So one recommendation from Crizel, who's our statistician in this call, is to have better monitoring for these proposals from conception to close out. For the qualitative data, our results are currently partial. So the interviews we conducted generated around 2,700 excerpts and 3,900 code applications. So we'll present a fuller picture of our results in the final report. So implications for Nura development muna. So we propose that we consider consulting with other PNHRS committees during development. Particularly, I think yung monitoring and resource mobilization. We want to coordinate closely with the DOH as they are the national health policy making body and probably one of the most, if not the most important users of health research outputs. We propose the retainment of the bottom-up approach and consider population consultations per cluster. By cluster, we mean North and South Luzon, Visayas, and Mindanao. We want to emphasize that inclusivity is a part of the process, definitely, but not necessarily the output. So we agree with one of the recommendations that the next Nura should account for resiliency by explicitly identifying high, mid, and low priority research areas or topics. We also suggest adding sa method or process, participants explaining their assumptions and rationale for suggesting certain research areas. Increase the use of online tools, specifically in soliciting research topics and scoring or ranking research priorities. And we want to explore one online and one face-to-face consultation per region or per cluster, actually per region. So before we only did one face-to-face consultation, but we actually think that exploring one online consultation can improve participation in the process since it's less costly for participants to attend online consultations. So that's probably something that PNHRS can explore. For the implications in the next implementation, I think these are just repeats of emphasizing some recommendations. For advocacy, I think we need to advocate more to non-consortium members if we want to increase the fulfillment of the Nura priorities. Annually report Nura implementation progress to our stakeholders, provide more guidance on research institutions on how they can align with the Nura due to its broad list of research areas. But we don't know how the next Nura is gonna look like, but for this Nura, parang they really wanted guidance kasi I think they found it confusing that the document was so long. Effectiveness, educate stakeholders on why monitoring is important, increase support staff in PNHRS. I think in particular, this was a good suggestion, guidance book or a reference on the research investment that the health sector needs to fulfill the Nura priorities and the midterm evaluation and revision of the Nura. For impact, explore more partnerships with CHED to mandate the use, specifically to mandate the use of HERDN by HEIs, to explore co-funding of grants, and to look for opportunities to improve monitoring of research, particularly including thesis reports of students. Be more open with sharing research outputs, easing the process of HERDN participation, incentivize research to publish their work, and involve researchers more in the decision-making process. So that's the end of our presentation, and I think we can we're open now for comments and questions. Thank you.
Thank you so much, Kim. Sir Paul, we open the floor.
Yeah. Thank you, Kim, for your presentation. Opening the floor for any queries, clarifications from our RAMC members.
Just to start a bit, okay lang? Start the ball rolling.
Ma'am.
Yeah, so I particularly like that online and face-to-face solicitation of topics to facilitate the regional consultations. Kasi it looks like we cannot move away from the bottom-up approach. Everybody wants to feel consulted. But that in itself will ensure that there will be a lack of much focus in Nura, because we're asking everybody, and everybody, personal and institutional, they have their own interests, they have their own agenda. So necessarily it will have to look that way. And I was telling myself, oh, I don't need to feel too bad because that's how the animal looks, diba? Kasi I wanted to know, do we really need the Nura after all? Everybody's saying, oh, dapat may focus, dapat mas maigsi. But we have to ask everybody, para bang how do you draw a line through all those different topics of interest? But yung one thing that I would agree on, online and face-to-face consultation, and still the regional consultations. That's all muna. Sige, yung iba naman mag-comment. Thank you.
Kim has a counter or comment on that.
Thanks, Doc. I think for us, we also still agree with the bottom-up approach, and yeah, I think it increases nga their feeling of ownership, and it's only good for PNHRS to do the bottom-up kasi they like being consulted, and once they're consulted, they're more likely to adopt the Nura. So one of the suggestions that we actually liked was yung sinabi na to account for the perspective of resiliency. So yung current Nura kasi does not explicitly rank the research topic. topics. It's thematically, Joseph maybe can explain better, but we did the regional research agenda, and then yung team ni Joseph and Doc Wenki did a thematic analysis, and because yung value of the last Nura was based on being inclusive. So for us, we want to, our suggestion, we want to suggest now we still account for an inclusive process, but I think the stakeholders or the informants from this study are also right in that maybe we should include a more explicit way of ranking the research priorities. Kasi I think everyone would agree naman na hindi talaga pantay-pantay lahat ng research priorities. Obviously, yung when COVID happened, became the research priority. So I think we can still be inclusive, we can still do the consultations. But we should probably use yung scoring data to aid in how we define which are the research areas that are high, mid, and low priority. We don't necessarily have to call it low priority, but we can arrange the research priorities in a way that's more transparent or true to the scores that they receive during the process. Yun po.
Shall it be related to the frequency and the times it comes out?
Kasi we use a weighted, yung process kasi in summary, yung end score is a weighted average. Tama, Joseph, no? It's a weighted average. So it's not frequency, but it's the weighted average relative to, it's basically ranking talaga siya. So merong may highest weighted average na topic or research area. And naturally, meron din talagang lowest. So I think that's a more transparent way of ranking them. And I think legitimate and credible naman siya kasi it's the participants that will score and rank. We just process the data po and present results.
Siguro you could tell us how many respondents should be non-registered or non-members of PNHRS, di ba? Versus the members. Kasi baka the members, baka they're mostly government, I don't know. Baka iba nga yung agenda nila, iba yung way of thinking nila, di ba? So, and then if we might overrepresent them again, if we don't keep a tab on how many responders are non-PNHRS members.
Yeah, I think that's something we can, definitely we will reach out to non-consortium members. But yeah, we'll think about that po. Kasi for us, it's about, parang for the inclusivity part, it's really about the representation of every possible research stakeholder. And then yung process na I believe is used is na-orient naman lahat ng iba-ibang research stakeholders, whether they're consortium members or non-consortium members, on the same problem issues. Like, kasi di ba last time nagkaroon pa nga ng regional ano nga yun pinagawa mo, Joseph?
This parang
situational
analysis.
Yeah. So every region before the consultations, may report na na-produce, ito yung health status of the region. But I agree na every stakeholder, even though you try to ground them on the similar context, may kanya-kanya pa rin silang dinadalang values and agenda to a priority setting exercise. But I think for us, parang we try to mitigate those things by yun nga, making sure na diverse po yung participants. And then making sure na we present them data na ito yung status ng region. So parang, pero sila pa din magde-decide ano pa din po yung research priorities nila.
Thanks, Kim. Ma'am Eva?
Thank you. I'm listening in. Ang iniisip ko lang, wala ba tayong exercise or activity or some initiative in the country that identifies the gaps, let's say, in the healthcare system that need to be answered? I was kasi we visited Harvard last week, 3 weeks ago, and also Massachusetts General Hospital, And it appears that from the US side, yun yung kasi nag-share sila ng information nila ng mga research being conducted, let's say at MGH, and other major institutions in the US coming from the US NIH. Parang sinasabi nila sa kanila top-down approach, no? So, of course, sa kanila sobrang variety ng kanilang mga topics, and syempre sobrang dami nilang pera. But in our case, yon, if is there a way that we can have a meron bang gumagawa nun? Kasi kung may gumagawa nun, ako tingin ko that's one of the most useful materials, kasi if we know that's really what we should do. Answer the questions sa health natin through research, di ba? So, and as I was listening to this conversation, sinasabi nyo nga na minsan, syempre, people who get consulted probably, bring in their area of expertise or their, kung ano yung naging, basta kung ano lang yung exposure nila, and may not really be representing what research needs there are for the country. Thank you.
Thanks, Peva. Kim, you want to comment on that?
Yeah. Hi, Doc. Thanks po. So I think yung top-down actually is very possible if we have a good research monitoring system for health, like specific to health research. If there's like a database where that we can access, tapos it's very organized, and we can find ano na ba yung topics na super na-address na in the last 6 years. And then ano yung mga research areas na medyo understudied, and then combine that with the opinions of research stakeholders. I think yun yung ideal, but it would rely on a very nice looking health research data. So yung answer is, I'm not aware sino gumagawa nun actually, but yun siguro yung data needs namin if we were to do that, Doc. Kasi that, I think naman po that's super ideal. Yeah.
What about DOH? Wala kaya sila, no?
Hello, good afternoon, Doc. From DOH. If I may chime in.
Hi, Ma'am Renee.
Yeah, so for example, we actually conducted our own review of the medium-term health research agenda of 2017 to 2022, where we're able to see which of the themes we have in the identified health priorities for research have actually been substantiated with research that was conducted, and which areas actually needed reinforcement, or some of them were not really attended to in terms of research generation. And in addition, in terms of areas where there would be gaps in the healthcare system, the national objectives for health document, which we are actually doing, for the next medium term, that would actually also point into some areas where research is really critically needed, and evidence to influence the decisions as well as interventions moving forward. So that's the NOH. And we are also working on the health sector long-term plan, or the health sector strategic directions for 2023-2028, which also points into some assumptions in health status that we would like to achieve, and health outcomes we would like to achieve in the next medium term. So that would also be a guide, as long as current is being vetted pa by the EXECOM. So as soon as these documents are already approved by the EXECOM, then we could gladly share to everyone that could also guide the health priorities and then research generation thereafter. Thank you.
Right. Thank you, Ma'am. Sir Alan?
Actually, you can have a combination of both, top-down, bottom-up. Pwede naman yun eh. So, but I'd like to go to the report now. Kim, most of the data is coming from your KI, your information. I'd like to know that.
Yeah, yung mga the qualitative data are from the interviews.
Yeah. So meron kasi akong problema. Only 12 of the 17 regions were tapped, di ba? If you're going to present this to the body, there'll be issues of who were interviewed, why were we not interviewed, yung ganun klase ba? So it's important to have a slide on your respondents who were tapped, a profile nila and all. I didn't see that eh. So kailangan may profile ka sa institutional level, anong types. Meron ka din profile ng respondents mo sa KI. Remember the people in the assembly, whatever it is, meron mga quality people and quantity people. So that brings me next to the quality component. Usually there's a school of thought kasi, you never quantify a qualitative data, never. There's some group, no? So it's best to have stories, though sabi mo naman some vignettes in your report, and even in your presentation, show it, what did somebody say? No, quote mo ba? Mas maganda yun eh. That's a good way. So yun lang yung medyo concern ko is the quality component eh. At saka yung bakit hindi lahat na tap. So that was your objective, 17 regions. And you're coming up with only 12. You wanted 70 KII and you only had 47. So there's a need to justify that eh. Kasi yan yung sa proposal nyo eh. Diba? That was your proposal. But it's not, since it's partial report, baka naman later madagdagan. Okay. I have other comments, but I'll just email it na lang to
Yes po. I think for the 12 out of 17, that's for the quanti. So if you remember the meeting about the evaluation plan, for the interviews, that was a set target, but we did mention na parang 30 is actually the minimum that we were targeting. And then we actually overestimated pa dun sa 70. So based on the evaluation plan, parang the 30 is actually a good number in terms of reaching saturation. So qualitative data. And then for the regions, yes, we targeted 17 for the quantitative part. So that's for the report. So we also reported that as a limitation. Despite our follow-ups, unfortunately, may 5 regions na hindi po nakapag-submit ng report sa amin. And then for this particular presentation, we did not detail the methodology kasi we knew na we would spend a lot of time presenting the results. But definitely, I think in the final report, that the methodology will be much more detailed than this presentation. Thank you.
Thank you, Kim.
Ang comment ko lang, there will be people, anticipate there will be people saying why were we not included, etc. No? So you need to be clear on that at the onset. So it's for the audience. I'm preparing you for the audience when you present these findings. So kasi maraming magreklamo niyan. I anticipate.
Thanks, Sir Alan.
Thanks po.
Just to a little bit comment lang kanina, siguro yung dun sa top-down versus bottoms-up approach. If you remember, I think the Nura 3 has been a bibingka. No? So meron kang top-down from the different policies from DOH, NIH, DOST, and CHED. No? Plus yung other national policies na ni-review. So parang siya binangga siya. And also the same thing, that's why there was a regional situational analysis na ginawa when it comes to problems as well. Yeah, so medyo na-consider na siya nung Nura 3, but siguro ang learnings we'll just have to identify it for the next Nura as well. Right, yeah. Other comments or questions about the initial results? Sir Tom?
Question from DOH.
Sige.
Sige po, si Sir Tom na muna po.
Yeah.
First of all, I commend the Salva sa pagkakandak ng study. I noticed that one of the recommendations is on the involving the policymakers and users to advocate Nura to policymakers and educate policymakers to appreciate evidence. So magandang aspect po yun to on ensuring na nagagamit. Yung question ko lang po, for example, we have this Nura list of priority researches, and then we are able to monitor po nga po ba na how many of these priority researches were conducted, and with that, how do we determine in terms of, for example, yung quality, if this particular research or the same topic actually really addresses yung concern or health concern. That's na reason for us identifying it as a health research priority. And then ayun, to identify nga po kung alin pa yung mga researches na or health priorities na hindi pa talaga nagagawa ng appropriate research. Kasi baka may instances naman na na-conduct na before and then nasasama lang sa list sa Nura but actually have been conducted na or meron ng nagawa na studies. You know.
Thank you, Sir Tom. I think quickly that goes back to the question or even the comments on the database. No? But partly, I think for this assessment, confirm this, Kim, in this assessment, more or less, ang kaya lang namin i-provide na answer to that is actually kung tignan nyo in terms of yung sa number of outputs against the themes ng Nura 3. No?
Yeah, so
and also in relevance.
If you saw the one of the first slides, right? So sa outcomes, that's not the scope of this evaluation kasi outcomes are only attributable up to 5 years after the program. So yung scope ng evaluation namin was really about outputs. Tapos second, yeah, we just did not assess quality of the proposals. That's a huge undertaking. So it was not covered po in this evaluation.
Yes, Sir Tom, but partly I think the question about yung relevance mo, yung tanong mo kung nagamit to or what, partly sasagutin siya ng details nung sa relevance section ng evaluation po.
Thank you.
Thank you, Sir Tom. Yeah.
Ma'am Renee.
Ma'am Renee.
Good afternoon. For DOH, we actually commend the work of the group. It is a very thorough evaluation of the Nura. I can't think of any group who could actually do this type of assessment at this point. But yes, at this point, I'd like to commend the group for that. I think I find a lot of the results interesting. Like, for example, the proposal to include publication in the TORs, for example, or even in the record deliverables for the proponents to incentivize the proponents into doing publications of their works. On the other hand, would it not also be more of like scaring off some proponents into undertaking research because they would be required to do the full series until publication, which could be tedious and could have them more locked in the study for a long time. You know? Your thoughts on this? Because I would like to see if publication is the way to go to really ensure that we do get our research translated into evidence-based decision making and policy development. And second, would also like to ask on the result in which there was the direction towards looking into how much research investment is needed to solve the research needs. Would like to ask, what was the scope of this question? Was it more of solely because of the Nura? So is it solely a question that rose because of the Nura's set of areas where you study, or is it more of like a national the national research in general, be it R&D, be it all other areas of the health that were not covered under the Nura? Thank you.
Thank you, Ma'am Renee. Maybe
Thanks,
we
Ma'am.
answer and then we call on Ma'am Aritha.
Okay.
Yeah.
So sa two parts, no. So about the publication, I actually agree with you, Ma'am Rene. I think including publications sa TOR or sa MOA is parang a pro and con. Kasi I think we all have experiences where okay, na-include yung manuscript, pero again, parang after we submit, the timeline of approval is not really within the control of the funder or the end user or the project team. So I think even though informants expressed na they think that would make it better, I think we need to temper yung enthusiasm for that. Maybe yung what they're referring to in terms of a more enabling research environment for publication is which I know that PCHRD does, is yung workshops where different researchers are not locked in. Pero there are 3 days na dedicated to completing a manuscript. And then of course they always appreciate na for PCHRD and DOH funded projects, there's always support for publication and presentation. So I think while it was recommended to include this as a deliverable, parang marami pa ring limitations in pursuing that option. And then on the second question about the research investment, that was something that emerged. So it was not actually part of a very specific question we had. Parang lumabas lang yan sa data namin na I think yung perspective nila is more national level investment on research. But did not go so into details na tinanong mo si Ma'am Rene. Yun lang. Yun lang. Yeah. I think yun parang the sentiment there was after the Nura, the next step is to let the research stakeholders know, specifically I think at the national level, how much they need to invest so we can fulfill our research needs according to the Nura.
Thank you, Kim.
Thanks, Kim. Maybe one last na lang. No? I remember there was this result that pointed into there's a need to have a better monitoring from conceptualization to close out. Were there specific areas of that program monitoring or project monitoring that were pointed out? What specific things that should come out in improving the monitoring of the research projects? Thank you.
So, Joseph, you want to do this? So there was a separate, actually we got a bunch of research results na out of the scope of our evaluation because we felt that it was evaluating the grant management process instead of the Nura itself. So we're not planning on wasting that data. So Ma'am Rene, I think we will probably provide an additional report that is not related to Nura evaluation at all regarding yung grant management monitoring findings that we accidentally found through our interviews.
Quickly lang yon kasi just to add on that what Kim said, Ms. Rene, is that so we just look at the agenda in itself. So pagdating dun sa program management, it's really out of the scope. So pero yes, the team already is planning to have a separate parang supplemental report that is beyond the scope of the agenda, no, of the Nura mismo. So yan. Okay. Ma'am Aritha?
Yes, good afternoon. More siguro of comments. Sharing also with you that I wear, two hats. One is with the regional consortium, and I thank you, Iho, for that very extensive research. And I feel that most of what you found in that research are things that we really deal with on a day-to-day basis when we do our operations and looking at funding researches. But as we all know, yung Nura all-encompassing as of now. So that's why 100% of all the protocols that we approve is really geared towards or follows the Nura talaga. So as you have found out, it was very difficult to monitor all those researches that are funded, and also regarding the quality of the researches, there are some, actually no, binavalidate ko lang, na some researches are actually funded because the funding is there, no, and it's, the topic is there that goes with Nura. However, later on, we did sa consortium namin, we did some quality assessment also, and we found out that we really do give projects the funding just because the funding was there. But the quality of the research, we find out later that hindi naman talaga nag-contribute dun sa mga gaps of researches na we would have wanted to be answered. So that's one topic also na na-touch din ninyo. This is a general question to everybody because most of the government institutions, like you said, has a 2% of the MOOE that is given as part of their research budgeting. Siguro sa amin, we find it difficult, especially sa institution namin, that this is not something that is spelled out in our institution. So we also would like to know kung saan nanggagaling or what legal document can we look at yung 2% of the MOOE as part of the research. Meron ba? That's a general question for everybody. So can
Dr. Liwag,
we
Paul
need
here.
help?
I think that's part of the yung current na tinatapos or they're trying to finalize under the PNHRS.
Yeah, okay,
na,
thank you for that.
PNHRS na implementing rules and regulation. Pero right now, I don't think may agreement na that was the proposed na magkakaroon ng 2% for the conduct of health R&D, pero I think so far hindi pa siya na-finalize and approved dahil there are some agencies who are still trying to clarify some some implications regarding that matter. Pero kung tinatanong niyo po kung saan siya nag-emanate, dun po siya dun sa rules and regulations ng PNHRS na up until now hindi pa po na sa sign I think yung clause na yon. But we'll try to get more information on that.
Thank you, Sir Paul. Ma'am Rita, additional?
Yeah. There, siguro to the question regarding, we were one of the consortiums who did not rank the topics of researches regard dun sa RURA or Nura because parang we felt at the time that it's the funding agency that really has parang mas may say kung sa anong researches ang ifa-fund nila. So it really depends kung sino yung mag-fund ng researches. We as users of the policies, like DOH now has a research agenda. Aside from Nura, and I hope I'm not jumping the gun for the group, no? But the harmonized national research development agenda has also been cascaded. So siguro yun yung question ko ngayon eh. What will the role of Nura and its relation with the harmonized research development agenda the next 5 years? How are we going to really put things into perspective?
I may answer that, Dr. Liwag. Actually, yung pinaka-broad talaga natin, the main template is the National Unified Health Research Agenda. So it basically involves, kasi di ba all health R&D, tapos nakaset nga tayo sa theme. Yung HNRDA, it is very specific sa DOST. So it's basically the health R&D focusing on science, technology, and innovation. As compared kunwari naman dun sa DOH, dun naman sila sa mga health service delivery and financing. Then dun sa CHED, I think they're also doing operational research. Then NIH medyo pareho kasi yung sa amin with DOST. So kumbaga yung HNRDA, the medium term agenda, kahit yung mga agenda po under the Philippine Development Plan kasama din. It's kumbaga doon nag-anchor yung development of the Nura. So kasama din yung yung WHO and even the SGDs. So yon ma'am, parang pinagsama-sama siya pero may certain sections dun sa Nura na doon nagfo-focus yung mga agencies natin. So kami, kunwari sa DOST, we're using the Nura and HNRDA both at the same time kasi we can only fund based on our mandate any health research related to science, technology, and innovation. Kapag kunwari health financing na, hindi na siya na-align sa amin. So napupunta naman siya sa DOH. So parang ganun ma'am yung naging natin. Naging delineation of funding with regards to those areas.
Okay, thank you very much.
Thank you, Rita. Ma'am Rene?
Yeah, we just like to chime in as well. So yes, we do a 6-year medium-term health research agenda. In fact, we are about to issue one this August for 2023 to 2028. And the way it interplays with the Nura is that the Nura is also our reference as we look into what are the other areas that the health sector and R&D are looking into, so as a whole, so that we get to see how DOH health priorities, how the secretary's priorities, and even presidential directives get to align with what's already in the Nura and what we have to also have something floated out in an agenda that is through the MTRA. And in terms of funding, we just recently issued last June 30, 2022, Department Order 2022-0420, which would be about incentivizing special research projects in the DOH and its attached agencies per Department of Budget and Management Guidelines. So essentially, this policy would provide for honorarium for research-related activities conducted as government special projects within the DOH and all other concerned offices. So this would provide monetary incentives for those in DOH and its attached agencies if they're conducting research in-house. So there's already a way how to monetize and to provide financial incentives for them. Thank you.
Thank you, Ma'am Rene. Baka po yung from chat, may comment po sila or question sa response.
Good afternoon.
Good afternoon, ma'am.
Yeah, nakita ko yung chat ni Doc Otaysa rito regarding the budget allocated for research. And I was able to look up the particular CHED memorandum order, but it is specific only for SUCs. And yung allocated budget, I think it's 10%, is allocated for all research activities, regardless of whether it's health-related or agri or kung anumang particular na research priority meron. So going back to the shared po na initial findings kanina, regarding doon sa slide on effectiveness, effect of Nura on funding allocation, it seems na there is really a need to include in the study, katulad ng sinabi ni Doc Alan kanina, yung respondents natin sa study natin kasi most of the informants, they said na they do not think that Nura has an effect on funding allocation. So parang medyo nahihit na dito yung issue of relevance, whether relevant pa ba na magkaroon ng ganitong research agenda or papaano ito ika-craft, goes into the procedure of crafting the research agenda to make sure na yung ma-create for the next round is really something that is relevant and effective to all of the stakeholders. So yun lang po. Thank you.
Thank you, ma'am. Doc Eva and then Kim. Yeah.
Sorry, mali lang.
Okay.
I just want, yes, thank you, Migs. I just wanted to ask, no, we're looking at all the ano ba to? An evaluation has been done on the Nura. But has there been also some evaluation on like how equipped are the regions and even in Metro Manila in actually submitting proposals that get funded? Kasi parang, we can have all these topics na pwedeng gawin, ang gaganda ng topics, but if the people in the regions do not feel, wala naman kaming chance dyan kasi, we tried, pero hindi kami na-fund. So meron bang ganong area na na-evaluate as well?
I think capacity of the regions on how to do research was outside the scope of the evaluation, but I guess one of the again, I think relevant pa rin yung recommendation on health research investment, number one. And then yung second, I think this alludes to one of the challenges that was mentioned, which is, tama ka, Doc, there's funding and there's a research priority area, but often, walang health research human resources available to do the research. So that was not a scope of the evaluation, but it was alluded to in some of the findings.
I understand. Thank you, Kim. Pero siguro tatanungin ko si Dr. Liwag, parang is that a general feedback also from, like, let's say Region 6? That is that something na parang they tried, they looked at the Nura, but then hindi naman din sila nag-qualify?
Ma'am, if we look at their topic, and it really fits into the Nura, but I think, that's one area that we also need to look at, the ability to go through the whole research process from the crafting of the research proposal even until the monitoring. So sabi ko, the monitoring itself is difficult because the researchers find it difficult to finish and to finish their researches. So sa rin yun, sa nakikita namin, that's a significant number of researches that we cannot finish until now. We're still monitoring. So capacity building is still real issue sa mga different consortiums.
Thank you, Mama Rita. Sir Alan and then Ms. Mayumi.
Si Yumi muna.
Okay.
Si Yumi muna.
Yes, sir. Opo. In addition po dun sa sabi ni Ma'am Arita, even if a particular proposal is well within the priority area, but once na isalang na siya, at least sa side namin as funding institution, once isalang na siya for technical evaluation and review, it seems na even if it's part of the priority area pero medyo kulang pa in terms of the quality, hindi rin siya nabibigyan ng funding. So perhaps siguro ang isa pang pwede na recommendation dito or at least suggestion is for the funding institution to conduct capacity building activities para at least the proponents themselves, they would know how to effectively craft their proposals considering na may priority areas na binibigay, ma-address din natin yung quality ng sinasubmit. Thank you.
Thank you, Ma'am Yumi. Sir Alan?
If you remember several PNHRS assemblies before, Dr. Sarol presented a report on capacity across the regions, if you remember. I don't know what happened after that, pero that was commissioned by the Capacity Development, Capacity Building Committee. to look at capacities across the regions. And it was done by Dr. Sarol, and it was presented in several fora of PNHRS.
Thank you, Sir Alan. Baka we can, Sir Paul, we can look at that again. No?
Yes, please. I will try to check that with the capacity building committee. Pero I remember na meron nga tayong ganung type of report.
Yeah.
Well,
Can I just chime in? Yeah,
yes,
I think that a different group has also delved into the capacity building. So lectures on research methodologies, and I think pati data management was done until last year. Pero that will need another assessment, I guess.
Okay, noted.
Sir Paul.
I think marami talaga tayong report that we can use. Well, sorry to interrupt the discussion. I think there are a number of questions, and some of them we can forward through email to IHO. Kasi in the interest of time, I know some of our members, meron pa silang other PNHRS activities and other events to attend to. Siguro Doc Migs and Kim, we can just collate some of the additional questions from our members so that you can assess it and incorporate it into the final report of IHO. So with that, thank you, IHO, Dr. Migs, Kim, and the whole team for your presentation. RAMC is looking forward to receiving the report, hopefully soon, kasi nasa third quarter na tayo ng 2022, and we're nearing the, we should be developing the next Nura na kasi for 2023. So if ever we need additional meetings or additional consultations, kahit puntahan natin yung bawat members for their specific questions, I hope you can accommodate us, Doc Migs. So with that, thank you very much, IHO, again for accepting our invitation to do the presentation with the RAMC. Thank you very much, and siguro let's before ko kayo paalisin, ngayon na tayo mag-photo para kompleto kasi closing na kami after eh. May I request everyone to at least open their camera.
Sir Paul. It's been a pleasure on the side of IHO.
Thank you, Doc Migs.
Work with you.
Okay. So si Doc A, can you open your camera? Okay. So Jov, please sige, start na. Are we done?
Hope to see you in person next time.
Okay, yeah.
Ingat kayo dyan. Sana okay ka lang sa earthquake.
Oo, okay lang.
Oh.
So, thank you, IHO.
Thank you. Bye-bye po.
We may leave
Thank
na
you.
one.
Bye-bye.
Bye.
Bye.
So, at this point, ayun nga ma'am, I think marami pa tayong questions, but they're going to forward to us the report, and from there we can send in our comments.
Kailan expected the final report nila?
Well, ma'am, nag-request kasi sila ng ng extension up until October 31. Pero sabi ko nga dapat tapos na lahat ng mga data gathering nila at that point. So, finishing.
Tsaka na-incorporate na itong mga comments na ito.
Yes, ma'am.
Bring up natin. Siguro what we can do is, well, we know we have the 6 years ahead of us. You make your 6-year calendar na, including the mid-year review. And if we're going to get another consultancy to to start the Nura, Then, well, how we're going to do it, whether we're going to mix the top down and bottoms up, that will come after they give us their final report, diba? And whatever
Yes.
details we want to include into the Nura.
Yes.
Does anybody have any other suggestion? Siguro just the 6-year calendar draft siguro muna magagawa natin.
Yes, ma'am. I
Pero
think kasi
tagal-
once they
tagal naman
finalize the report, yun nga, upon our recommendation, then we can develop kasi ATOR kasi there's no assurance naman na sila pa din yung gagawa ng next
Yeah.
Nura eh. But for the last 3 years naman kasi sila, so they have the familiarity. Pero of course, sa
Yeah.
procurement natin, talagang gagawa po tayo ng TOR ng RAMC, then yun po yung siguro magiging guide in the development of the proposal.
Oo.
Ilalagay niyo doon, has had experience doing 2 Nuras. O, di, wala na. Ano na
Wala
yun?
nang makakasali.
Wala na makakasali. Pero ano lang, just one small comment. Siguro talaga we really have to like really what's this? Interact with yung utilization, yung research utilization.
I was going to say that nga. Kasi parang naglalag behind yung RUC namin sa consortium. Ang iba yung level ng RUC namin sa level na in-expect natin sa national. So, paano kaya palitan yun?
Kasi baka dapat meron tayong joint why did I emphasize that? Kasi nga again at the end of the day, parang how were the evidences produced by research used by the Department of Health, 'di ba?
Yeah.
Yun naman ang talagang natin kaya ka nagre-research to improve our health cares, the system, whatever. Kung hindi natin nagagawa yon, apart from of course discoveries are important too, pero dapat pa rin yun nagko-connect sa sa healthcare delivery system. So parang tingin ko dapat talaga, kaya nga naisip ko na baka importante din yung top-down approach.
That's why I was thinking, Eva. So why don't we start off citing the top-down, but we will still do the exercise of bottoms up. Tapos you connect the dots. What's common to both?
Right.
But if you were the big funder, you would look at those with impact, which is the top-down topic, di ba?
Correct.
Malamang yun na kasi nag-ferment na yan eh. Alam na nila anong kailangan talaga ng bansa eh. Oo. And maybe that could stimulate more collaborations that matter.
Katulad na lang kunyari, yung issue ng stunting. I mean, it's a very relevant topic, pero parang walang nagte-take on yan eh. And stunting is connected to like eventual, di ba? Yung sa mga intellectual, ng mga bata. Anyway, thank you.
Oh, thanks. Yeah, I was thinking our own RUC talaga eh. Sabi ko, ba ito? Sana nga mas maganda yung impact ng studies. The quality reflecting Aretha's concern na, they're not really national, but yun ang pondo mo eh. Yan ang interest nung nagre-research. Kunwari ENT siya, di ENT yung topic niya. Wala yung stunting doon. Di ba? Parang gano'n. Okay, so may question pa ba? Or suggestions?
Siguro, Dr. Taisa, inform ko lang yung team na we are planning to, of course, launch yung panibago nating Nura on the next PNHRS. So, our working timeline is from today up until, siguro around
365 days. Kasi di ba PNHRS nyo yung nilalaunch?
Yes, ma'am. Pero I hope by the second quarter, ma'am, medyo ready na tayo. So at least if we need any additional materials or collaterals for the launching, magawa po natin. And hopefully face-to-face na po yun. So para at least the RAMC can really present to the PNHRS yung panibago po nating Nura. So then, siguro i-add ko lang po na as part of our activity, of course, after the presentation of IHO, nakita po natin na medyo marami pang talagang challenges and then may mga other information pa that we really need to gather. So rest assured lang po na the Secretariat will be consolidating all of these issues. Then we'll try to develop an activity and also yung communication plan like you mentioned, Dr. Otaisa, then we'll start doing institutional visits para at least ma-complete po natin itong mga kulang na data na we would be needing.
Paul, pwede ka bang mag-establish ng Viber group? Isa na naman ito. Iba na naman Viber group. No, kasi para, if like there is some thoughts that we float out para we don't need to go. Minsan natatambakan yung email ko eh.
Yeah, I
Pati nga
understand that.
Viber ko natatambakan eh. But if there are some questions or thoughts that the group would like to float even without the face-to-face or online meeting, pwede nang ma-consider natin while we're formulating our ideas about how the next Nura will look like, di ba?
Yes, ma'am. Opo. Pati, of course, if we have other initiatives sa RAMC na pwede po natin ma-introduce. Kasi one of the ideas na naiisip ko is if ever we're going to have the possibility of having parang a super R&D na talagang nakapool yung funding from the core agencies and regions, then basically the topic would really address any specific topic na ma-address yung sa 4 core agencies or one of the big topics natin sa Nura. So that is something na we can discuss.
If I may raise din po pala, sa rin, yung suggestion nga po on having a database. Kasi we have a Nura, ito yung ating what we need, ito yung research agenda natin. But I think maganda nga mabangga siya with what we already have na list of mga studies. And in terms of utilization, like for us then, may times din kami nga na we need information or research-based findings or information. Yun, basta naghahanap kami, but wala maganda sana yung merong specific na dedicated na website or na source na makita namin na ito na yung not just yung listing but also kumbaga considered na good quality na type of researches. And then so that rin for the succeeding Nuras, pwede nating i-base kung ano pa yung kulang from what we already have or kung ano na kailangang i-update or ganun po.
Okay,
Sir, di ba nasa herdin po ba yan, sir?
Yes, nasa herdin, but I think yung in terms nung sa sinasabi ni Sir Tom na on quality, well, kapag na-approve, of course, there's a sense of quality. Pero of course, we're still looking hindi lang naman doon sa appraisal but also on the monitoring and evaluation sa conduct mismo ng project. But yes, yun din yung naisip ko yung I think the initial database that we can look into is yung herdin. Then if ever there are other database, ang plan kasi is really to integrate all of those into one system and yung herdin yung maging main. Yun po.
Sir Paul, siguro in relation to that, I think one of the more important things na ni-raise naman din kanina, yung ma-publish sila. Kasi the publication is already a way of vetting it, di ba? The quality kasi na-peer review siya. Of course, wag lang siya mapunta sa predatory journals, but merong kung peer-reviewed siya, parang na-validate na yung methodology, yung results, gano'n. So, baka dapat yan din ang strengthen ng requirements ng PCHRD. Talaga bang pre-namis na may publication talaga, 'di ba no?
Yes.
Thank you.
That's right. So I think marami po tayong activities sa RAMC that will really bridge or connect with capacity building, with resource mobilization, and even then sa monitoring and evaluation. So the Secretariat will try to organize all of these comments. And yun nga po, as instructed, we'll try to prepare the activities for the next 6 years. Of course, for the Nura, pero yung immediate plans po natin for RAMC. Yan po. Okay, so at this point, siguro since we already discussed naman yung mga naging highlights and yung mga instructions, siguro I can request na lang po si Dr. Otaisa to give her closing message, and if you have pahabol instructions to the RAMC group before we end this meeting.
Wala na, close na, tapos. Hindi, I'd like to on behalf of RAMC, I'd like to welcome again and thank everybody for your participation today and for the next, 6 years. So it's another commitment, a term as long as our present administration. And to me personally, my involvement with RAMC has always been something uplifting because I really meet people of the highest caliber, not necessarily in the highest positions, but really the thinkers and the planners. Pinaka-highest na siguro dyan itong Eva Marie na to eh. Pero namamangha ako, kagagaling mo lang ng Harvard. Okay, sige, congratulations.
Ni ma'am, kasi kailangan natin makita kung anong meron sila para magaya natin.
No, but I think that the RAMC, tayo yung patriots na plodders, we just do the scut work and we plan for others so that they can achieve. We are the enablers eh. Kasi kung wala tayong Nura, walang direksyon, walang pupuntahan. Can you imagine a world without the Nura? Okay, so thank you very much everybody, ha? Sige, Paul, sa'yo na. Thank you.
Thank you.
And may our next meeting be in because I really need to eat bagnet by Dr.
Very welcome. Yan si
nag-request naman ma'am ng face-to-face meeting eh. So
pinaplano na yan eh.
Sige, plano niyo, Paul.
Yan.
Okay.
Sige, with that, I know we need more time pero yun nga ma'am kasi nga we need to manage our time then during this PNHRS week. I would like to thank the RAMC members again for attending this meeting. Si Sir Tom, si Ma'am Mayumi, si Miss Renee, si Doc Liwag, syempre si Doc Eva and Dr. Otaisa. Then of course si Doc A. Then of course our very busy po sa preparation nito yung ating RAMC secretariats. Marami silang assignments for the next couple of months. So again, thank you very much all and I hope you can attend some of our activities sa PNHRS up until the end of this week and I look forward to again meeting you face to face na po sa susunod. Alam ko may mga individual meetings tayo pero I hope we can meet as a group again. Okay, thank you very much and good afternoon.
Bye, Dr. Malu. Bye-bye.
Bye. Take care. See you tomorrow.
Bye-bye.
Take care. See you tomorrow. Bye.
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 Hi, Abby. Marinig mo ba ako, Abby?
Yes po, sir.
Kala ko nandito ka. Hinihintay ka namin.
Virtual lang po ako, sir.
Virtual ka. Walang kasama pa naman sa room si Nika. Dapat pala sumama ka na dito. Sige.
Ingat po kayo dyan, sir.
So, if ever na may na lang yung mga na-document mo, I know some of them medyo mahirap pang intindihin. Just forward it to just forward it to Nika and Joel for consolidation. Okay?
Yes po, sir.
Sige. So,
medyo challenging nga po, sir, kasi nawawalan-walan po ng internet connection dito sa extension.
Talaga? Buti pala nandito kami. Sige. Okay, thank you. Sige.
Thank you po, sir.
Thank you. John Paul, thank you din for assisting us. Thank you.